Welcome back. Today I want to talk to you about home infusions. I get home infusions, and basically what a home infusion is instead of going to the hospital to get your medication or drugs, the nurses actually come to you and you get it done in the privacy of your own home. It does have some drawbacks. I mean, there's some good points and bad points about it, and we'll talk about that later in a video. But this is kind of the first video of it. So actually, FedEx just came in the deliver box. So this is kind of the first part of a home infusion where the pharmacy will order your drugs for you. They'll call you and say that, hey, your drugs are going to be here on Friday. You kind of want to make sure you're there because typically, like what I'm getting is IVIG. There's $15,000 worth of drugs there. You don't want to leave it laying there and have someone steal it because it's just a whole mess, and that's actually happened to me before. So anyways, they just rang the doorbell, so let's go ahead and grid it, and we'll unpack it, and I'll kind of tell you what it's about. So you see FedEx just does, they'll just leave it at your door. And since I'm not the strongest person in the world, it's a little hard for me. Maybe have your little spouse or your loved one do this for you. So basically just FedEx box. Just bring it over. And what you want to do is when it comes, you'll definitely want to be here for it. You're not going to want to let it, again, sit on the porch for someone to steal it. IVIG is one that actually needs to be refrigerated. So you don't want it to get hot. It basically needs to stay at room temperature or in the refrigerator. I get mine and I stick it right in the fridge, and then the day before the infusion or the night before, I'll take it out and just get it to room temperature. And again, that will be the next one, the phase 2, I guess you would call it. So anyways, let's open this up and unpack it, and I'll kind of show you what comes from the pharmacy. You get your little handy dandy knife. Now be careful not to cut yourself because these are very sharp. And that'd be very bad because, of course, with sick people, we don't heal well. So anything you bruise or any cut you get, it's like there for, oh my goodness, I thought I cut myself. Okay, so you basically open up. Be sure to put the knife away. You don't want your knife to be laying around. I'll just stick mine back in my pocket because I feel like a man, with it in my pocket. So anyways, go ahead and open it up. The nurse will always order this the last time. So when the nurse was here last month, he ordered what supplies I'm low on, which is really, really, really nice. So basically you can unpack it, little popping, you can have fun later on going pop, 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 play with these while you're getting your infusion. So you just unpack it. That's the IVIG. That's the IVIG. You can see they do a good job of, well, they should do a good job of bubble wrapping it, because that right there is probably about $15,000 at retail with the IVIG. So that I'll kind of stick to the side. And then basically this, what I'll do is I'll just unpack this. You don't need to check it in, because when the nurse comes here on the day of an infusion, he'll actually check it in. I'll just kind of unpack it. I'll definitely make sure the drugs are there, because if the drugs aren't there, that's your biggest thing. You'll want to call the pharmacy right away and say there's a problem with it. Saline, gauze pads, just everything you need. And then here's like a packing slip. Be sure to save that, because the nurse will go ahead and check that off, and then they'll send it back to your infusion company. So basically I'll take that, kind of set the box aside for right now. And I'll show you in phase 2, actually have like a whole tub full of supplies that I keep for him, and that's upstairs along with the infusion pole and all that. We'll bring that down next time when I'm actually getting the infusion. But the main thing about this, so I'll set this aside. The main thing is the drugs, depending on what you're getting. Get a little handy dandy knife again. Mine, IVIG, needs to go in the refrigerator. So basically, that's it. That's a type of Prevagen, is a type of the IVIG that I get. There's actually, this is one day, this is one day, this is one day, and this is one day. So there's about 4 days there that I'll get the infusion. So I won't show you the refrigerator, but basically I'll unpack this, stick it in the refrigerator, and then basically that's it. And then you wait for the nurse. Usually your infusion company will set up like what days and what times. I mean, they'll come anywhere. I've had a nurse come, at 8 o'clock in the morning all the way until 3. Again, it is nice because you're in the privacy of your own home. You can sit and watch TV, you can go to sleep, you can do whatever you want. It kind of depends, if the drugs really, how they affect you. I always hate in the hospital, if you have an adverse reaction, you're with, like 6 other people and you feel like you're gonna puke and, the nurses throw the curtains and you're sitting there with a bowl over and there's people staring at you. So that's nice in that aspect. So we'll do phase 2 when the nurse is actually here. If you ever had home infusions or you do home infusions, if you just want to comment below, tell me, do you like them? Do you not like them? What are the pros? What are the cons? What type of medicine are you getting infused? So thank you for showing up, for coming. Please subscribe and welcome to the journey, and we'll see you next time.